Thank you very much. It is my great pleasure and honor to join all of you today. I want to thank President and CEO Davis, Dean Charney, your Board of Trustees President, Peter May, and recognize the incredible, illustrious award recipients who you're going to hear a little bit more about, Sir Mark Feldman and Dr. Camara Phyllis-Jones and Dr. Allison, but really to also recognize the faculty, the parents and trustees, and most importantly, the graduates. Woohoo! I am in awe of your skills and talent, and as you've already heard, it is an amazing time to be in healthcare. And there is a shift and a revolution underway from sick care to a real health system, and you all will be at the forefront of that. I have had the enormous honor to be in a key place in this administration at this moment in history. And I will always be grateful to have played some role in the shift that's occurring. But I want to talk for just a couple of minutes about that journey and share with you what may be some lessons learned. You'll be pleased to know that I did not bring my 400-page PowerPoint on the Affordable Care Act, nor am I going to tell you the intricacies of putting together a website. But I will talk a little bit about some of the opportunities. So how did I get where I got? I, first of all, won the birth lottery. Had great parents. No choice on my part, but I got lucky. I ended up being educated at all girls' schools, which in my era meant that I was raised in an environment where girls did everything. I wasn't told that there were rules for boys and rules for girls, and that turned out to be very fortunate. I had wonderful teachers and mentors, taught me to work hard, find passion, and certainly learn how to give back. And I had lots and lots of good luck along the way. But one characteristic I want to talk to you a little bit about, which seems an odd thing to raise in a room full of scientists and people rooted in training, is the willingness to take risks. Now, risk is identified as gaining or losing something of value, acting in spite of uncertainty. And I just want to tell you a little story about probably the biggest risk I took and how it turned out. So I had served in the Kansas legislature and had been reelected a couple of times, but there was an office in Kansas, the Office of Insurance Commissioner. It is an elected office in 13 states, including Kansas. And I frankly knew nothing about the office. I knew some of the people who were there, but in the 50 years before I chose this race, there had only been 3 commissioners, each of whom served for almost 20 years and then succeeded. There had never been a woman. There had never been a Democrat in the history of the state of Kansas. I knew no one who worked in the office. But I had this sense that the office could do some pretty important things and probably could have something to do with healthcare if you worked it right. So I found 2 mentors, one who led a big company and one who was part of the agent and brokers community, and convinced them that I should be the next commissioner, and they decided they would help me. I then decided to take a pledge, and these are all risk steps. I took a pledge that I wouldn't accept any money from anyone who was regulated by the office. Now, that may sound like a big risk to take. Frankly, it was a relatively small risk because I was running against the incumbent, and anyone would have to have been out of their minds to give me money if you were in business in that state. But it was a way to say to people, this is what goes on in this office. They take money from companies and they basically are on the company side. It was a way to begin to educate Kansans who frankly knew no more than I did about the office. And then I did a very risky thing, which was to decide I would take the test to be an insurance agent and broker, because I wanted, when I traveled around the state, to be able to say to people, I have the qualifications to do this. And I studied. The bar is pretty low for agents and brokers, at least it was in that time in my state. But I got into the room and it was a computerized test. And at the bottom of the screen it said, the results of this test will be sent to you and to the Kansas Insurance Department. Now, the test wasn't a requirement for the race. It was, in fact, something that I thought would be a good idea. But I knew, even though the results were supposed to be confidential, that it would take about 12 seconds for the staff to inform my opponent, who happened to be the insurance commissioner, that I had failed the test. And I really had to take a deep breath and decide whether I should hit the button that said send. It would be a short campaign, I figured, if I failed the test, saved me a lot of time and energy. But took a deep breath, again, feeling that something important could lie ahead, and hit send. I passed the test, I won the race. And that decision and that office led me to, a couple of years later, being appointed by President Clinton to a National Health Commission on Patient Safety and Patients' Rights, chaired by Donna Shalala, who became a great mentor and friend. It led me to a great deal of accumulated knowledge about health insurance and how to serve consumers, and frankly, the fights that doctors were having and continue to have, where insurance companies stepped between them and their patients and tried to control decisions based on cost. It opened the door for me to run for governor, establishing a statewide platform and then having the credibility to say to people, I've done this office, you know me, I can be helpful to you. And most importantly, when I was asked by President Obama to serve in the cabinet, the skill set that I acquired years earlier as Kansas Insurance Commissioner became one of the most important skill sets I brought with me to HHS, because at the federal level, no one had ever regulated insurance. They had never set up a market. They didn't deal with companies because all of that is done at the state level. And I say that to all of you. I don't assume most of you are going to run for insurance commissioner. So this isn't a lesson in that political idea. But it's a lesson in terms of taking a risk, giving yourself permission to fail, knowing that the opportunity to succeed is there and won't ever be harnessed unless you take a leap. You have to give yourself permission to try, to find stretch goals, to find mentors, and to follow a path. You are joining, as graduates, a handful of the best educated people in the world. There are very, very few human beings who have acquired the skills and talent that you have sitting in this room. So you have a big responsibility to go forth, to do good work, to make a positive difference each and every day, and to give yourself permission to take some risks along the way. Reach high. Even if you don't know what's behind the door, kick it open, because you are capable and you have an opportunity, as the dean said, to reach for the stars. Celebrate your success, and certainly spend some time thanking the folks who made your journey here today possible. Congratulations and best of luck.